again, I'm Mike Duggan, and this is video 6 of the healthcare series that I'm putting together so that you'll understand more about the healthcare system. This particular video describes healthcare system segment 4, the regulatory community. That community which seeks to control the delivery of healthcare in this country. We have already looked at the wellness community, which comprises all the people that are intimately connected together in terms of delivering healthcare to patients. We've talked about the legal community that basically sets up a liability issue in terms of the healthcare providers, and we've talked about that in detail. We've talked about the healthcare industry, which takes a direct profit from the healthcare delivery of healthcare to you. They take a profit from your needs. They take a profit from your illness, in effect. But while they are profit-making organizations, they have a huge impact for the good or for the bad. And that's what we have to sort of figure out, and we'll do that together. But the regulatory community seeks to control all of that. So there's a lot of different entities that are part of the regulatory community. I don't know if you've added them up yet. I referred to them in the first video, but between the wellness community and the legal community and the healthcare industry and the regulatory community, there are 24 different entities that I've outlined that all interrelate to basically comprise the healthcare system, and you can imagine how complex the interrelationships are. Now, later on we'll talk about, okay, you must feel awfully small when comparing yourself to that huge superstructure of the healthcare system. On the other hand, you don't have to, and we'll talk about how you don't have to. Okay, so the regulatory community, they pass laws, they make regulations, they enforce regulations, they provide information or disinformation. All by seeking to take control. Now, they might not necessarily be a government agency, could be somebody completely different from that, but if they're trying to control the way healthcare is delivered, I'm putting it in this regulatory community kind of loosely. Some of them are pretty obvious, like the government. State and federal governments, they're representative, they're basically representing the people's vote. So when you have a local representative, it could be a federal legislator, federal representative that's elected locally, he goes to Washington and so forth. He represents the voters in his jurisdiction, in his constituency. His goal, her goal, of course, is to positively impact their constituency. And why do they want to do that? Well, of course, they want to be reelected. They want to do some good, hopefully, but they certainly want to be reelected so they can keep doing things and, keep their job and what have you. But, certainly they want to positively impact those people they represent. They voted for that person, they voted for them, and, they owe them to try to take care of them in one way or the other. Of course, they're lobbied very heavily by the industries that are in their jurisdiction also. And so they're also lobbied very heavily in order to write laws that would benefit those industries that are in their jurisdiction. And whether those laws are vague or definitive might be depending upon competing legislators that are lobbied by different industries. And so they compromise, and then everything's too vague to really be useful. So when laws are that vague, as we've discussed before, that puts healthcare providers in a very difficult situation. The goal is to write clear laws, to set clear boundaries. Laws that set clear boundaries are effective. But, again, that's, maybe challenging to achieve in, our government legislature, whether it's the state or the local level. Again, there's lots of competing interests. So we've outlined some of those already. Professional organizations, so the American Medical Association, the American Dental Association, and there's the equivalents at the state level in all the different states. Their mandate is to protect the dues-paying members, which are the providers. So they inform the public of information and about the particular healthcare area that they're looking out for. But their real mandate is to protect the dues-paying members. They lobby, for sure. They accredit schools, dental schools, medical schools, and all other kinds of schools. They are responsible for making sure that they work according to a set standard. And they set ethical standards as well for that particular discipline. So professional organizations, pretty important, and they have a lot to do with how the particular healthcare discipline is carried out. Okay, testing agencies. Okay, so whenever you are licensed to practice, whether it's medicine or dentistry or nursing or anything like that, there are tests involved, and you have to pass those tests. Those testing agencies are supposed to be independent of the schools that train the candidates for these exams. They're supposed to be independent of the licensing boards that grant the licenses. And they're supposed to be independent of the professional organizations. That latter independence has been a little bit compromised in the last few years, at least within the area of dentistry. But in any event, testing agencies are quite powerful because they set the standards for licensure. A state will say, okay, we will accept you to get licensed in this state if you pass a certain exam. And the lawmakers in that state decide which exam they're allowed to take that would grant them licensure. And I was involved in a situation some years ago where in California, we had a California board exam for dentists, and there was another board exam that was a more regional or more it's a regional exam that covered about 20 or 30 different states, but the California board exam was specific to California. Well, the law said that if you want to get licensed in California, you had to pass the California board exam, and it was difficult. It was so difficult that after a while, the students that had graduated from the dental schools weren't passing it very well. Their passing rate was less than 50%. So the schools got together with the lobbyists and went to the state legislature and changed the law so that now they could take the other exam, which is the regional exam, that was easier. It was easier to pass. So, if the candidates for the exam don't do very well, if the students that are graduating from school don't do very well, let's just make the exam easier. Okay. That was something I was very angry about at the time, let's say. All right, and then there are enforcement agencies. Each state has enforcement agencies. They actually provide the licenses, they enforce regulations, they revoke licenses. They will require remediation if a provider wants to get his license back again or get out of suspension. They accept complaints about providers. So there's boards and councils for the various different healthcare disciplines that provide these services within the particular state. Okay. So, and then the most interesting one is political parties and their news outlets. And this has become more obvious to me in the last couple of years. I think it's been more obvious to a lot of people in the last couple of years. Their goal, again, it's their goal, they're trying to control the way healthcare is delivered, but they will impact the healthcare that you seek. Okay? So if they provide you some information or disinformation, as the case may be, and you believe it, it tends to alter, what you want to do, what you want to get. Again, the healthcare you seek or demand. So it's very interesting. I mean, if you just look at this data, the vaccination rates for COVID and the hospital rates and the death rates if you look at it state by state or even county by county within that state, and you compare it to how people vote in that county, comparing red states and blue states and so forth, there's a huge correlation between the states that vote blue, tend to be more democratic, with a capital D, tend to have much higher vaccination rates than the states that tend to vote red. And again, that relates to hospitalization and deaths as well. And so you might ask yourself why that is. That would be a very interesting question. Also, political parties, political persuasion, and news outlets impact the availability of healthcare. Look at Texas. Texas has made some huge changes recently that impact the availability of healthcare. Whether you agree with it or not, it's true, and it's politically driven. I would like you to ask yourself a question. And that question is, who benefits when a 12-year-old rape victim is forced to have the baby? I'm just going to let that hang out there and see if you can figure out an answer to that question, because it's kind of interesting. And it relates a lot to what we've seen in the last few years in this country. Anyway, that's an interesting question. The bottom line is that behind everything that impacts healthcare, money is being made. If you keep that in mind, everything that impacts healthcare, behind that is somebody making money. Yeah, that doesn't say anything about, again, the wellness community and the providers. They're in the trenches, working, taking care of you. But there are a lot of other entities out there. I've listed 24 different entities, and most of them are profit-making, and most of them are seeking to either control or make a profit from your need for healthcare. All right, so we have now very carefully outlined what the healthcare system really looks like when we break it down into all of its individual components. And so we'll be moving on pretty soon to look at some other subjects that have to do with the people that are in these different entities, the people that are related to each of these 24 different entities. Again, what are the personal characteristics of these people that really determines the way these entities work for you or against you? And can we imagine that it might actually be better than it really is? The bottom line for that is that if we want it to be better, it's the people like you that are watching this, especially you patients, that are the reason the healthcare system exists. The healthcare industry is the motive force behind the healthcare system, but you're the reason it exists in the first place. And you can have a say. You can speak up. You can speak out. When you understand more about the system that we're involved with this huge superstructure, I think we'll see as we go along through the successive other videotapes in this series that we're going to end up with you thinking that there is actually something that you can do. And, you might do something like I'm doing right now.